Hey everyone, and welcome back, Focus Learners, to Part 6 of our Physical Therapy Masterclass Explainer. Today, we're really bridging that gap between the clinical side of things and the strict administrative coding rules. We're going to be looking at some of the most dynamic physical therapy treatments out there, which are constant attendance modalities. Now, if you're a medical coder, a biller, or a physical therapy clinician, you already know that translating hands-on patient care into perfectly compliant documentation, well, it's pretty much an art form. So my goal today is to bring absolute clarity to these specific codes so you can document and bill with total confidence.
All right, here's our roadmap for today's explainer. We're going to follow a clear clinical to clerical pipeline. We'll start with the constant attendance rules, then jump into CPT 97034 for contrast baths, CPT 97035 for ultrasound, and CPT 97036 for the Hubbard tank. After that, we'll cover audit-proof documentation, and finally, wrap things up with a preview of Part 7.
Okay, let's dive into this with Section 1, the foundational constant attendance rules.
So whenever we talk about constant attendance modalities, we're fundamentally talking about time-based codes. The core definition here is absolutely critical. This requires the therapist or the assistant to be in constant attendance, actively providing skilled therapy. This is definitely not a situation where a provider just sets up a machine, leaves the room to grab a coffee, and checks back in 20 minutes later. No way. These modalities require direct, one-on-one contact with the patient. And because they're time-based, the CPT time rule strictly applies. That means your exact times must be rigorously documented in the medical record for these treatments to even count. You are counting the exact minutes the patient is actively being treated in timed 15-minute intervals.
Moving smoothly into Section 2, let's unpack our first deep dive modality, CPT 97034, contrast baths.
So this perfectly captures the physical mechanism of a contrast bath. As we can see, all or part of the patient's body, very often a limb, like the legs, is immersed first into hot water and then immediately transferred right into ice water. This intense alternating procedure of hot and cold immersion is repeated several times throughout the therapy session. And remember our rule? The therapist has to be right there, guiding the patient, closely monitoring their skin response, and timing those intervals between the warm and cold water with total precision.
So, the crucial point is understanding why we actually do this. The primary goals of this treatment include decreasing pain, knocking down swelling, and really speeding up athlete recovery. By forcing the blood vessels to rapidly dilate in the heat and then constrict in the cold, it actively pumps the area, which improves blood circulation and overall mobility. But coders, take note of this. Contraindications include impaired sensation or severe vascular disease. In those cases, these extreme temperature shifts could actually cause severe tissue damage, so it's a huge red flag.
All right, shifting gears to Section 3, CPT 9735 Therapeutic Ultrasound. Let's break down the exact physiologic effects.
Now, it's important to clarify that unlike a diagnostic ultrasound, which we used to see inside the body, therapeutic ultrasound uses thermal acoustic energy. Depending on the setting, which is typically 1 MHz for deep tissue heating and 3 MHz for more superficial tissues, this induces a highly targeted temperature increase to the skin, fat, muscles, and joints. The therapist is actively moving that ultrasound wand over the patient's skin in continuous attendance, delivering that thermal energy right into the problem areas.
Now, what's really interesting about this is exactly what that thermal energy achieves once it's inside the body. The physiologic effects include some serious pain relief, along with a big increase in local blood flow and metabolism in those specific tissues. But honestly, the most important part, it drives collagen remodeling and actually improves the elasticity of the connective tissues. Think about it. If a patient has locked up hyperactive muscles or severe joint stiffness, the heat from this ultrasound actively remodels those tissues. It's essentially the perfect prep work before the therapist moves on to manual stretching or exercises.
But, as with any really powerful tool, there are serious risks. We constantly have to contrast the clinical reasons for prescribing this against the contraindications where thermal energy would be downright dangerous. We know we use ultrasound for pain, muscle spasms, and joint stiffness. But look at the contraindications. You absolutely cannot use this on patients with peripheral vascular disease, bleeding disorders, acute inflammation, or neuropathy. Why? Well, think about introducing deep heat and cranking up the local blood flow in an area that has an active bleeding disorder, or fiery acute inflammation. It's incredibly dangerous. And for patients with neuropathy, they literally lack the nerve sensation to tell the therapist if the heat is burning them.
Let's move on to Section 4 and introduce our final constant attendance modality of the day, CPT 97036, the Hubbard tank.
And this brilliantly illustrates exactly what we're talking about. A Hubbard tank is essentially a massive, highly specialized hydrotherapy tub that allows a patient to be completely submerged in water. This full-body immersion physically supports the patient, which dramatically reduces the gravitational stress on their joints and muscles. It's a very intensive therapy, and it's typically used for patients dealing with severe mobility issues, extensive burns, widespread arthritis, or intensive post-op rehab where they simply can't tolerate normal land-based therapies. So let's look at how this builds on some basic physics. The absolute core scientific mechanism working inside the Hubbard tank is buoyancy. Buoyancy is defined as the upward force exerted on an immersed object opposite to gravity. In a clinical setting, this upward force acts like a giant liquid cushion for the patient. By counteracting gravity, buoyancy actively reduces their pain and discomfort, which then allows the attending therapist to guide them through gentle range of motion exercises. But again, strict contraindications apply here. This cannot be billed for patients with bowel incontinence, uncontrolled cardiovascular disease, or severe hydrophobia.
All right, let's pivot to the clerical side of our pipeline in Section 5, Audit-Proof Documentation. Because clinical knowledge only matters if your chart notes can actually survive an audit.
If you are billing these time-based constant attendance codes, your treatment encounter notes for a single date of service absolutely must include these 4 exact steps. Step 1, the date of treatment. Step 2, a crystal clear description of the treatment, intervention, or activity provided. Step 3, the total timed treatment by individual modality, meaning if you did 15 minutes of ultrasound and 20 minutes of a contrast bath, you have to document those individual times separately. And finally, step 4, the total treatment time in minutes, which is just the sum of all your timed and untimed codes for that day. A huge pitfall I see is lumping all the time together without separating out the individual modalities. That is an immediate, glaring red flag for auditors. You've got to break it out minute by minute.
And that brings us to Section 6, our outro, and a quick look at Part 7. Thank you all for staying so focused during this highly technical deep dive.
As we look ahead, definitely get ready for an exciting Part 7. We're going to be tackling the absolute core procedures of physical therapy, directly comparing CPT 97110 therapeutic exercises against CPT 97112 neuromuscular re-education. We'll learn exactly how the provider-specific intent dictates which of these codes you actually use. Until then, ask yourself, would your charting from today survive a surprise Medicare audit tomorrow? Keep your documentation crisp, keep your modalities perfectly timed, and remember to always decode healthcare with Harshal.